evening, friends. First of all, I thank the organizers and the Luminous Company for this kind invitation and hospitality. Uh, HOLEP is there now for last nearly 12 years in India. We had the opportunity to start this HOLEP in 99 at RG Stone Clinic, Bombay. And for last 12 years, I have been involved in treatment of prostate with holmium laser. When a patient comes to you, what does he exactly want? His expectations are very, very simple. He wants that he should stop pissing on his legs. Passing urine should be more of an enjoyable session. He should not strain for urination. He wants that the urination flow should be good. He should be able to pass urine in a group and not feel ashamed of himself. He should sleep peacefully at night and not peacefully in the bathroom. He wants the flow rates to increase from a poor flow rate of 5 to 10 ml per second to maybe 20 to 25 ml per second. How can you achieve this? You can achieve this either by a conventional treatment which may give him a lot of tensions, uncomfortable perioperative period, red urine, significant amount of pain, or you could give him a less morbid, affordable, safe, recent and effective treatment. So friends, that is for you, TURP versus laser. Before we begin, let us accept one thing very, very clearly, that TURP is the gold standard in treatment of BPH. What we mean by this? We mean that any new treatment that comes up should be at least as good as TURP. So, does holmium laser stand this test? This was a paper published 12 years ago by Peter Gilling, and after this multiple papers have shown that holmium laser is definitely comparable to TURP on both the fronts, reduction of symptom scores and improvement of Qmax. The complications in both, in this paper they had said, are equal. These good results are maintained over long term. As long as 7 years follow-up in this study by 10 has shown that the good results of TURP are maintained. The reoperation rate in this group was 15%, and if we realize this is the standard reoperation rate after any form of prostatectomy. A very recent study of more than 1,000 patients followed for nearly 3 to 10 years has shown that holmium laser is safe, effective, complications are rare, and it shows a durable long-term result. Friends, if TURP is gold standard, then why are we looking for a change? We are looking for a change because we are bothered by the complications, limitations, hospital stay, and cost that a patient has to spend to undergo a TURP. The standard paper, which is always quoted for complications of TURP, has said that the risk in TURP may be as high as 17 to 25%, and the immediate post-operative risk could be between 3 to 15%. These risks could be in the form of needing blood transfusion, needing clot retentions, having TUR syndromes. There can be long-term risk of bladder neck stenosis and urethral strictures. Even mortality in first 1 to 3 months has been reported. In comparison, for holmium laser, the post-op course is usually very smooth. The catheter comes out faster. It's a smaller catheter. Hospital stay is shorter. Patient goes home within 24 hours. In this series, in our setup, we keep them for 48 hours, and most of the patients would go home at 48 hours. In the immediate postoperative period, neither hemoglobin nor serum sodium levels change, so patient is maintained very well hemodynamically. In the early postoperative period, from 3 weeks to up till 9 months, holmium laser has been found safe and effective, and the major advantage is reduced intraoperative hemorrhage and perioperative morbidity. I do not mean holmium laser does not have complication. It has all the sets of complications that are described for TURP, but the risk of these complications is significantly less in holmium laser as compared to TURP. Holmium laser also does not affect the sexual function. In 64% patients, the sexual functions after holmium laser prostatectomy remains unchanged. Now look at the limiting factors of TURP. We would be afraid of doing TURP in large glands, associated comorbidities, patients with bleeding tendencies, if there are associated urological problems, and even TURP has a significant learning curve. How many of us would be willing to demonstrate a TURP when you have done only 40 to 50 cases of TURP? For TURP, most of us would be comfortable doing a gland which is around 60 to 80 grams, but for holmium laser, any size can be treated. And the outcome is not dependent on prostatic size. Holmium laser can treat all prostate regardless of size with favorable results. For small glands, it is definitely good. The operating times are comparable and the irritative symptoms are also comparable for small glands. Even for larger glands, initially Peter Gilling started with glands up till 75 grams, and this was the study in 98 where he had said that even for 75 grams in a period of less than 1 hour, adequate treatment can be done and nearly 90% patients can be discharged on this in a day without catheter. Larger glands more than 100 grams, yes, holmium laser can be done. It is indeed quoted as a true endourological alternative to open prostatectomy. For larger glands followed up till 5 years, we have seen that the results are well maintained and comparable to open prostatectomy group. Late complications are lesser in HOLEP group than in open prostatectomy group. So it is indeed a true endourological alternative. Very recent study, prostates as big as 175 grams. In this series, it ranged from 175 to nearly 390 grams. Look at the amount of tissue removed. In one of the patients, they have removed 532 grams tissue. So even as big prostates can be managed very well by holmium laser prostatectomy. A very interesting point raised by Hemendra Shah, where he has said that the larger the gland, the more effective is the prostatectomy by laser prostatectomy, because you spend less time in enucleating a larger gland as compared to time spent for enucleating a smaller gland. So the amount of tissue enucleated and morcellated per minute, if you compare for small gland and larger gland, it is more effective for larger glands. What about associated comorbidities? Most of our patients, because they are elderly, would have some associated comorbidities. One thing which we are worried most about is the risk of bleeding tendency or patients who are on anticoagulants. In these patients, laser prostatectomy can be performed successfully without needing transfusions, without any major complications. Very interesting study, recent study, where they prospectively assessed 39 patients of average gland size who were on oral anticoagulants, and they found that the blood transfusion, clot retention and TUR syndrome was not observed in any patient. And because of the excellent hemostatic properties of holmium laser, even in patients who are on oral anticoagulants, this procedure can be done. All I would want to say here is, if you are in your initial learning curve of holmium laser prostatectomies, then do not take patients on anticoagulants. Once you have achieved reasonable experience, then HOLEP can be done without stopping any of these oral anticoagulants. Many times with prostate, we would have associated conditions like strictures, stones and tumors. All can be managed very well with holmium laser. We all know that for stones, there is no lithotripsy, intracorporeal lithotripsy device better than holmium laser. The advantage in bladder stones will be, if you use lithoclast for large bladder stones, the fragmented edges of the bladder stone, they damage the mucosa. This does not happen with holmium laser, and the bleeding for bladder stone treatment with holmium laser is very, very less. Strictures can be excised. In this paper, they have presented it as an alternative to urethroplasty. I would not go so far in saying this, but I would say that with holmium laser, we can get results as good as conventional VIU, if not better. Definitely they are better than conventional VIU. Bladder tumors, both small and large, can be completely excised by holmium laser, including getting reasonable bladder-based biopsies. The prostate that you remove is very good for histopathological examination, and the quality of tissue is similar to TURP. Talking of learning curve, there is a lot said about learning curve, but remember friends, most of us would graduate to Holmium laser after doing reasonable number of TURPs. So we are well versed with the anatomy of prostate, we are well versed, our hand-eye coordination is well developed, and at this stage to learn a new endourological procedure is not difficult. People like me may take 50 to 70 cases, but most of you will be able to manage in much less than that. Is it a costly affair? Yes, the initial investment is there, but the recurrent per patient cost is very less. One laser fiber, which would cost approximately 35 to 40,000 rupees, would easily last you around 40 to 60 cases. So if we look at the recurrent per patient cost, it may not even go beyond 1,500, which is again comparable to TURP. You definitely reduce the hospital stay, you reduce the costs of irrigations and the care, nursing care in the hospital. So there may be a net saving for the patient in Holmium laser. Have we reached a place where we can call this a gold standard? For any treatment to be called a gold standard, it should withstand the test of time. Holmium laser in India is there for 11 years, worldwide has been there for nearly 20 years. So it is a treatment which has withstood the test of time. The results, the durability of results has been confirmed beyond doubt. Multiple systematic reviews have shown that the effects of TURP and Holmium laser are comparable and safety of Holmium laser is far superior. Holmium laser scores on all fronts: bleeding, hospital time, catheter time. The only thing which TURP scores on is probably the operating time, especially when you are doing a small gland. The results, as we have discussed, are maintained for 3 years and may also be maintained for longer. It should be considered a gold standard now because you can remove whole lobes of prostate and all lobes of prostate. All sizes can be operated on. It is as safe as TURP with significantly less morbidity. You get a good amount of tissue for histological examination, and associated problems can also be treated. Look at one aspect as to how a patient chooses his treatment for prostatectomy. If we look at statistics in 86, nearly 96% chose TURP for their patients. And in 96, this is a British study where 350,000 prostatectomies, TURPs were done in 1986. With time, this number should have increased, but rather this number went down. What this shows that if you inform the patient well about the available modalities and let him participate in the decision making, most patients would end up choosing Holmium laser prostatectomy. What would be the ideal treatment for prostate from our point of view? Low risk, affordable, successful, durable, no side effects. Except probably on cost, Holmium laser scores on all fronts. Thank you.